Hello, and welcome to the next in our series of afternoon chats with our lovely professional members of staff here at Newcastle Premier Health. For those of you who don't know me, my name's Mark Philpott and I'm the Managing Director for MPH Group. I'm joined today by Patsy McKenna, who's our Occupational Health Manager. Hello Patsy, thanks for coming on. Jill Davison, who's our Occupational Health Advisor, and one of her colleagues, hi Jill, and one of her colleagues, Deb Kelly, who's another occupational health advisor. So we're really lucky today. We've got three highly experienced members of the team. And we thought that today it would be really useful to come together and talk about some of the latest guidance around the COVID-19 situation, especially as we're starting to get an idea that businesses are beginning to consider plans for opening up again and getting back into work. And as we know, we're waiting for an announcement from the Prime Minister this weekend about what that will look like. So yeah, the idea behind these sessions is really just to kind of impart some information very informally and to give people that we work with, our clients and anybody considering working with MPH, some useful information that they can start to consider and apply as part of your planning when looking to get people back to work. So on that note, we'll kick off with our first question this afternoon. We've got about 7 questions, so it shouldn't take more than about 20-25 minutes. And then you'll be able to play this back in your own workplace as you see fit or through our website. So the first question I've got, and a lot of this has come off the back of experience that we've had dealing with clients in the last few weeks, well, last month or so, really. So we're trying to draw on our kind of working knowledge as well as our professional expertise. So a good place to start, perhaps with you, Deb, is around some of the changes that have happened, and what are the changes in the government guidance that have happened most recently that people should start thinking about?
The changes there's been lots and lots of changes in the government guidance, and that's coming about because the more we learn about COVID-19 or coronavirus, whichever term you want to call it, this is new to us. It's new to all health professionals, and how that virus behaves is very, very new, and that is driving any changes that the government are bringing in with regards to PPE requirements for certain settings. It's driving on a regular basis changes in whether or not somebody should shield or be stringently social distancing or just standard social distancing. So there's lots and lots of changes, and it's all being driven by the science. And I know that's something that the government keeps saying on a regular basis. It's all being driven by the science, but it is. And it's important that everybody understands it's not just the science that's taking place in the UK, but it's also science that's coming from abroad. They're talking to each other and they're working through what they're finding, how they're finding it, whether it's mutating, whether it's changing, and how it's impacting on us as humans.
Yeah, and I guess one of the challenges with that, which if I can just feed off the back of that answer,
Yeah.
which is very helpful, is that because it's people have talked about this being a novel virus, so it's new and it's different, and we're learning all the time, aren't we, about how it's responding and what's affecting different people and different groups of people, and I guess because it's so new and it's evolving all the time, that's what's causing some of the uncertainty around the guidance. Is that fair to say?
It certainly is. I think, I was listening to the news this morning and updating, like everybody else does over a cup of coffee at breakfast time. And, there's a massive impact on the BAME population. And once this all settles down and the research really gets into the nitty gritty of who suffered the most with this and what the impact has been with regards to people passing away and those that have had to be admitted into ITU, those who've managed to get through this with just very, very minimal symptoms. They will be researching all of that to find out what is the common thread, if there is a common thread. This virus is unsettling for a lot of people. It's frightening stuff, and the impact it's having on us as a population is quite big. So,
okay, great. And I guess we just have to keep rolling with the guidance and adjusting all the time and responding to that until we get to a place where ultimately we've got a vaccination and we've got treatments that can help to really suppress, what's happening in the community around the spread. And with any luck, I guess that's what's going to help people get back into full-time work with all the social distancing measures having been taken away. But until then, we're just managing the process of working with the guidance and just trying to keep a lid on the amount of infection in the population, and I guess in work, because that's what we're kind of really focused on, isn't it here? Trying to stop people getting infected when they return to work.
Absolutely. And I think it's important that everybody understands when the girls and myself are doing assessments, or our doctors are doing assessments, we're not just assessing what's going on today, but we're looking at the guidance and we're looking at whether or not that's changed. And I'm sure the girls will agree with me, in the very, very beginning, stuff was changing on a daily basis.
Yeah.
You thought you were up to speed with everything, and then all of a sudden you'd come in and there was something different.
Well, that's a perfect lead-in. Sorry, Deb, to cut you off there.
Yeah.
Perfect lead-in for the next question that I had, actually, which was for Patsy, around, what are the most recent changes in the guidance that businesses perhaps should start, all of us should think about, but maybe in particular businesses should start to plan for if they haven't already given consideration to the most recent changes. Could you give us some insights into your experience so far with that, Patsy?
Yeah, of course, Mark. I mean, what most businesses ask us are, is someone okay to come to work? Depending on the background, depending on the health issues, depending on their social circumstances, is it safe for that person to come into work? So the frequent questions we get are, has this person got symptoms? Have they potentially acquired symptoms, or could they potentially acquire symptoms from someone? Or do they have a health condition which might require them to shield, which are those extremely vulnerable people who are required to stay at home and not leave home? But the most difficult context is deciding between those people who are in the next level down and how vulnerable they are, or whether they just can abide by normal social distancing. So there are certain health categories that we look at to identify those people, so we can make sure that stringent measures are taken to protect them. And those stringent measures mean that you must not be within 2 meters of another person. So if your work allows you to do that, then you can go to work. Always the preference is to work at home. However, if your job doesn't allow you to, then the business needs to look at what controls it can put in place to make it safe for you to be at work.
Perfect. So one of the things that we've heard come up quite a lot, and you've touched on it a little bit here, is this understanding around what the difference is between standard and stringent social distancing, and what does that mean for us in the workplace? I know, Deb, you've had experience of this too, and you, Patsy. So either of you feel free to maybe elaborate on what do we actually mean by the difference between standard and stringent social distancing, especially in terms of how it might apply in the workplace, perhaps.
So the standard means that you can be at work and not be within 2 meters and be safely working. However, there are areas of work where we know can't be undertaken unless 2 or 3 people work together. And for those people who are vulnerable, that really wouldn't be acceptable. But for those people who aren't vulnerable, who don't have any general health problems that could be made worse or could be more at risk of developing coronavirus, then you need to look at what PPE, personal protective equipment, could be used to help that person be at work. And if you look at even just the NHS as the example and the different categories of work, some have very high level of protection because they're directly exposed to people with the known virus, and others, such as care homes, have a lesser level of PPE because there is potential for contact. They are within 2 meters, but they have a different level of protection. So that's the difference between the stringent, as in you can go to work, but you need to be having some level of PPE in case of even a transient exposure. That means a short duration of just passing someone, and how you're then protecting that person when they're at work.
Okay, so I guess what businesses really want to be focused in on is, if they haven't thought about it already, what does the social distancing look like in their workplace, on the shop floor, in the offices, when moving between different parts of the building or factory or whatever that their work premises look like, and what steps and measures can they take to try and limit contact where there, may be some vulnerabilities or issues that could impact individuals, or the risk, or just present as a risk of cross infection. Because as we know, even if people are cleared to return to work because they're not exhibiting symptoms, I suppose the risk is always there that if we do start to relax some of the measures that the government currently have in place around lockdown, there is of course going to be an increasing risk of the potential for people to pick up the infection just from having contact outside of the home. So I suppose regrettably there's always going to be that risk of some people picking the infection up and carrying it back into the workplace. But so it's therefore all about businesses starting to look at how to limit that risk and mitigate that risk within their area of responsibility, I suppose, much in the same way as the government is looking at reducing that risk across the population as a whole.
Yeah. It is, and businesses have to remember things like bathroom facilities, canteen facilities, car park facilities, making sure that people can access and egress safely. That, if you have a small main gate that everybody has to go through, normally everybody just queues up and goes through. They've got to maintain that 2-meter distancing when they're coming through those doors as well.
Yeah, good point.
And office staff, making sure that there's space between desks in offices.
Yeah.
And that's going to be challenging for a lot of places when people come back to work.
Sure, very helpful. Okay, and great. And I've heard people talk a lot about the R number. Some people may have heard of that in conversation, others not. Could someone provide some input into what that means? What does the R number mean?
The R number basically is, sorry Patsy, were you going to speak there?
Or Patsy, it doesn't matter, either or.
Yeah. The R number, basically it's how many people are likely to be infected. So what you're looking for is a very low R number. The lower the R number is, the less number of infections there are likely to be. The higher the R number, the more potential there is for an infection occurring.
And so is that R number, is that something that's being monitored on a central government basis? Because presumably workplaces can't establish their own R number, but they'll know what it is in terms of the whole population. Is that right?
The government are managing that one. They will tell you what the R number is. I'm sure I've seen it on the daily bulletins. As I say, we want it to be under 1 and as far under 1 as possible.
So the impact, I suppose, for leaders in businesses is to recognise that this number exists, and the risk of infection in the community or in the workplace could be higher or lower. And if it's slightly higher, then I suppose that should result in them starting to give even more consideration to the measures they should be taking as an employer to try and limit the risk of cross-contamination in their employee workforce, I suppose.
Government will also do that. Sorry, Patsy.
It's the chance of you infecting other people or other people infecting you. And the more people you have contact with, especially close contact with, the more risk you create as an individual. So all of us are being tasked by the government to reduce that R rate as far as we can, so we limit the spread of the infection from one person to another. So that's the simple term. So yes, you're quite right, putting into a work perspective, if you have lots of people working together and not social distancing or eating together or standing in queues waiting to get in together, then the chance of passing on that infection increases. So the idea of the lockdown was to reduce that risk of transfer of infection. Perfect,
that's very helpful. I'm sure that's not lost on most of the clients that we work with, but it is useful just to kind of remind ourselves about some of these key points. Okay, let's move on to testing. We've had a lot of discussion in-house about where we're going as an organisation to provide testing in the future. And of course, our position at the moment is that we're not offering testing right now, primarily because the government's advice from Public Health England or through Public Health England is that the specificity and sensitivity of the immunity tests that are out there at the moment isn't quite where it needs to be in terms of their reliability. And there are lots of questions emerging about, even if you've been tested and you show to be immune, then there's still questions about how long that immunity will last. So the science is changing all the time, the testing is changing all the time, but we are working towards a place where we can offer testing as part of our COVID-19 screening program for our clients, to help them manage their people. And when that happens, we'll be reintroducing the testing, providing, of course, that it's been approved by Public Health England as well. Because we don't want people to not feel it's going to add value to the whole process of checking the immunity of employees. So currently, one of the things I think that confuses people is, who's eligible for testing? And, at this present moment in time, why is it that, some people should have access to testing and other people shouldn't? Do you want to just kick that one off? Jill, have you got any thoughts on that? Because you've been involved with one of our key clients looking at some of the programs we've tried to put in place with them. What are your thoughts on that?
Well, I think that the eligibility for testing's certainly increased from what it was. They are testing more people, but it still seems to be mainly focused around people who are symptomatic. So all essential workers, including NHS and social care workers with symptoms, would be eligible for testing. You can get a full list of who is classed as an essential worker on gov.uk website. Anyone now over the age of 65 who is symptomatic can also have a test. People who have got symptoms who cannot perform work from home, for some example, would be construction site workers, plumbers, shop workers, delivery drivers. They would be eligible for testing now. Anyone who has symptoms of coronavirus that live with any of the aforementioned, NHS workers and patients without symptoms are being offered testing in line with NHS England guidance. And I know that there is social care workers and residents within care homes with or without symptoms are being offered testing now in relation to the outbreaks, to investigate outbreaks following successful pilots as a part of the rolling programme to test all care homes.
Yeah, great. And actually, you raised an interesting point, because when I sort of asked the question at the beginning and just positioned it a little bit, I was focused on the immunity side of the testing.
Mm-hmm.
But of course, there's the other test, which is the one you're really talking about now, which is the PCR test, which is only for people who are either suspected as having got symptoms or have demonstrated that they do have symptoms. And that's basically telling people, isn't it, that they've either got it or they haven't.
They've either got it or they haven't, positive or negative. And I think from the immunity testing point of view, that's still in the stage for approval, for full approval.
That's right.
Still in that stage at the moment. So it's mainly the testing that's going on at the moment is for positive or negative to the virus.
Yeah, perfect. So that's great. So, yeah, very helpful. And I think that guidance will probably change. I know the government's trying to ramp up the amount of testing that's available. I think our position on it as a business is it's unlikely that we're going to see the testing rolling out to everybody freely across the whole country, because that's a huge undertaking. Mm. But they are focusing on groups that need to be tested to try and make sure that, we can manage, if you like, the infection, and also to start the process of track and trace when people have been identified as having the symptoms. And I guess that's coming, isn't it, over the next few weeks. So we'll keep people posted on what we're doing as a business to help provide advice and guidance as part of our screening program in that regard. And that's useful to know where we stand today in relation to what's happening with testing. So moving beyond testing, because I'm sure we'll come back to that at a later date, I guess what we're also hearing, and we're looking forward to hearing the Prime Minister talk about this at the weekend, is businesses are starting to gear up for getting employees back to work and opening up factory doors, etc. And although I know the majority of businesses will be thinking about this, I'm sure there'll be people out there who just don't know quite where to turn in terms of what they should be discussing as a team, either from a health and safety or from an HR point of view, or even from an operational perspective, about the measures that should be taken to help get people back to work safely. I wonder, Deb, whether you can provide a perspective on what the main sort of management considerations are that people, should be considering when returning to work in the next couple of months.
I think Patsy's better placed to answer this because she's been working with one of our local businesses quite closely.
Okay, Patsy, you happy to pick that up?
Yeah, of course. More than just one. Quite a few of our businesses have people at work because they are considered as being key workers and necessary to help our country keep doing what it needs to do. So within sort of transport, travel, and people who, even manufacturing metal parts to go into, the life-saving devices that we need are all still running as companies. And one of the main things that they're doing, and it's something that we heavily support, is the pre-shift checks. So there's a designed questionnaire that the employees either look at before they leave home. And if they're concerned that they might have symptoms, then they contact their HR department. Or that screening could be done as the person comes to the gate. So certain sites run it through their gatehouse, who at a safe distance ask the questions. And then the other check that's done is a temperature check to see if somebody is exhibiting symptoms of a fever with a raised temperature. And that could be done at a secondary stage of assessment where you can pace people coming in a bit more easily. And that seems to be proving quite important in a lot of cases as part of the safe return to work, and making sure that nobody's coming into the workplace carrying symptoms or potentially being able to spread the virus to their colleagues. So they're looking also at working practices. So a lot of the companies are looking at single person operations and making sure they're done in an isolation place. So even your vulnerable people who are at risk of, or higher risk of developing the coronavirus, are working in a single person operation. So they're not interacting with anybody else. They just deliver or manufacture or make that part in isolation, then they put it into an area where someone else can come and collect it. So it's about doing your risk assessment to make sure that your most vulnerable are protected, and your people who are quite fit and well at the moment are a bit more easier to manage and can work in groups that work together. More important things are looking at staggered breaks rather than overfilling the canteen areas, so people aren't trying to worry about where they're going to sit. And a couple of the companies that we're looking after, actually people go and sit and have their break in their car. And when we've been having some nice weather, they've even been having their break on the grass, which is quite nice to do as well. So it's about being inventive with what you do, and things don't have to stay the way you've always done them. It's about thinking about how your risk assessment could be looking and how you can better manage it in light of the concerns that we've got right now.
Yeah.
Certainly when it comes to looking at PPE that might be needed. If companies are struggling, we've been giving advice on the types of PPE that might be beneficial for people to use. And again, if people are struggling to acquire that, that's something we can help with as well.
Great, blimey, there's a lot of information in there, but that's great, Patsy, and a lot for people to think about. And I suppose the take-home message is, if people are struggling in businesses with understanding what to do or how to interpret the guidance and what that means for them, then of course there is always a line to us, and we're more than happy to try and help and put plans in place with people if they need that support. So that sounds great. I'm sure we'll return to this area on many occasions in the next couple of weeks, as we fine-tune our advice and guidance as well about measures and steps people can take. So I guess the other message is keep tuned in and keep up to date with what we're saying, and hopefully people won't go too far wrong. I suppose on a more personal level, something else we've heard businesses talk about, is around the impact on employees returning to work and how do they feel? Because it's all very well and good us sitting back and listening to the guidance about the practical steps towards releasing lockdown and getting people back to work from a process point of view. But there is an emotional side to this as well, isn't there? Which is how do employees actually feel about returning to work, and what is all that about, and what are the sort of things that businesses might want to start considering, which perhaps because they've been so focused on the whole social distancing side of life, haven't maybe thought about the impact on how their staff are truly feeling. is it worth just elaborating on that a little bit and just giving some experience from all of your perspectives really on what you've heard from patients, well, not patients, but from employees that we've been talking to about this? Who wants to kick off?
Well, I think that we've all probably, whenever we've spoken to clients, there's a lot of worry, there's a lot of anxiety about returning, and I think, you know, we could all probably tell different stories from speaking to various people, but the main concerns are really that they don't want to catch this virus, and they don't want to catch this virus or take that virus home to their family. And that's probably the biggest concern that people have if they go back to work. Are things going to be in place so that they're safe? Have the risk assessments being done? Will there be PPE? Will it be the appropriate PPE? Will there be enough? Will other people, their colleagues, will they, you know, follow good hygiene practices the same as themselves? And will there be availability of hand washing and hand gel? Basic things that they want and will need and should expect, but they worry about it. Will it be available? And it's ultimately because they don't want to catch the virus and they don't want to take it home to their families, to their loved ones. A lot of these people may not have underlying medical conditions themselves, but they live with people who are either shielding or have underlying health conditions, which therefore makes the person that lives with that shielded person have to be particularly strict in following the social distancing measures. So that's a concern for a lot of people as well. Even down to things like commuting, how they get to and from work. You know, not everybody drives. They haven't used public transport. A lot of people, I know for the companies that I deal with, car share. You know, so it's lots of things to think about rather than just let's go back to work. And it's a big worry for a lot of people. I don't know about the other girls, but I'm sure that we've all found the same from speaking to the clients.
That's really useful insights. Do you have other points, Deb and Patsy, to add to that?
I think Jill's pretty much summed it up. All of the clients that we speak to are coming up with the same things. They are just really worried about how this is going to work in practical terms. How do I manage this? How do I get to work? Am I going to be safe? Am I going to be safe?
Yeah.
So I guess with that, I mean, it's a nice way to finish this little session off today, because, and this is never meant to be a, you know, an opportunity to sell as such, but we are here to provide advice and guidance to people. And as you say, Jill, very often it's the simplest steps and measures that can be put into place without it having to cost the earth, that can just give employees the reassurance that they need. And sometimes I think, you know, the impact of what you've said on people's mental health and to a certain extent their physical health, very often as a manifestation of how they're feeling mentally, is something that can be addressed if businesses know that they've got a route to help. And that's certainly something we help with. That's what we do, and we're here to support businesses and get the North East in particular up and running over the next 3 or 4 months, as we will be doing with our own team as they return to work to service all the clients that we have.
Yeah.
In reality, Mark, if anybody tells us that they're not worried about anything, I'd be quite worried about them.
Yes.
This is an anxious time for everybody, but we will get through it. You know, if we take our time and just look after each other, we will get there. Absolutely,
we will. Absolutely. And we will, because what we're doing is we're doing things like this and we're helping people to understand the issues that they have to manage and address. And I know that people will. So that's been great. Thank you very much for all of your time this afternoon. You're brilliant as always. Love having you on the call and chatting about all this stuff. And we'll be here again, same place, same time, 3 o'clock till 4 o'clock every Thursday afternoon with MPH Group, whether it's our own staff or partners that we work with. We're here to try and open up our knowledge box and give people insights into little things they can address in the workplace. So on that note, we'll stop recording and say thank you very much, and we look forward to seeing you next time. Thank you.
Thank you. Bye-bye.
Bye.